Ella de fábrica de estufa. Le voy a hacer la historia bíblia sensato pa' que la conozca.
Mr. Todo el mundo, el taxi sensato del patio.
DJ Chino.
Hi everybody, my name is Dr. John Lucio. Welcome to our YouTube channel. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Today's topic is migraine headaches. But first off, if you've never joined us before, we upload 1 to 2 videos a week about medical issues treated from an integrative medicine approach. So subscribe if you haven't and hit the notification bell so you know when we've uploaded our next video, and hit the like button. How we're going to arrange this video is we will give an overall just intro to know if you have migraine headaches. You probably already know if you do, but if you don't, you might want to listen and see if that's what you have. We're going to go through both prevention and treatment, which means how to stop a migraine when you already have it. And these are all from an integrative perspective, because migraine headaches itself can really be treated and give you a better quality of life if you take a whole body approach. And so that's what integrative medicine is all about. So first off, if you're wondering if you might have a migraine headache, ask yourself these 3 questions. Do you have a headache that's kind of prevented you from doing things in your normal activities, whether it's work or fun or dates, that's affected 1 or more days in the last 3 months? So if you've given up something for 1 or more days in the last 3 months because of a headache, it could be. So keep that question number 1. The second question is, do you get nauseated or have gastrointestinal upset when you get a headache? So answer that question. And the third and last question to see if you might have migraines is light causing you, does it bother you to see light when you have a headache? That's called photophobia. If light makes the headache worse or makes you more nauseated, then answer yes or no. If you've answered yes to 2 of these 3 questions, you could have migraine headaches, and you'll want to talk to your doctor about that, because they also, some of them will do more extensive neuro testing just to make sure there's nothing more serious.
A lot of times your physician will prescribe you medications that typically work for most people. However, a lot of individuals do have some significant side effects. So a patient that comes into my office and they're asking for treatment options regarding migraines, they do not want to take prescriptions medications, then the couple of things I have them do, one of them is really to just look at their lifestyle. By that I mean there's issues regarding and improvements that can be done in terms of stress management and yoga and some other techniques we talked about in our other videos work as well, including breath works, proper exercise, of course, and proper sleep hygiene. And we had, again, in one of our previous videos, we did mention that. One of the most important areas with migraine treatment is when I have a patient, I always start asking them about their nutritional habits. And some of them are kind of put off by this and don't understand why I'm asking this question, but there are a number of food triggers that can actually bring on migraines, and some of them include things like red wine. Like I personally have trouble drinking red wine. I will almost always get a headache within 20 minutes after drinking it. Aged cheese also will precipitate migraines. MSG, the common preservative we have in a lot of foods. Chocolate, unfortunately. Onions, among others that will do this. So it's very important that you have a food diary, and if you do have a migraine, this will actually help you kind of determine which foods and things that you can or cannot tolerate. Now there are some nutritional supplements that can be used as well. One of the most common is magnesium. Magnesium in some studies have shown that decreases the frequency of the headache, doesn't actually decrease the actual severity of it so much if you take it by mouth.
Interesting that we learned is that magnesium comes in different forms. The type that you most likely have in your cabinet right now is magnesium oxide. Magnesium oxide is wonderful, there's nothing wrong with it, but it does cause more gastrointestinal side effects of increased bowel movements. So that's why your doctor might have said start with a certain dose once a day, wait 2 weeks after taking it once a day, and if your bowel movements are not as loose, then you can build up to twice a day. Well, for migraine prevention, you want to get the form of magnesium called magnesium glycinate. Magnesium glycinate has a lot less gastrointestinal side effects of increased bowel movements, and it helps migraine prevention better than the magnesium oxide.
Another one is called riboflavin, which is vitamin B2. It's very safe in pregnancy. It actually has some synergistic effects. That means it works better together with beta blockers, which is another common group of drugs that are prescribed for migraines. The other one is called coenzyme Q10. I know a lot of you have heard that. It's been in the market now to help with heart health. And that does have some studies that show that does helpful in terms of preventing migraines. Now, another common one I hear tossed about is omega-3 fatty acids. Now, I guess the theory behind these is that omega-3 fatty acids have an anti-inflammatory effect, so therefore it will decrease the frequency of the headaches. However, the studies really, at least the ones that I've been able to find up to now, do not show that that's actually true. It's not a bad idea to take them, but if you think you're taking them for migraines, it's really not going to be that effective. Some of the botanicals that we have learned about that actually help with migraines, one of the most common is feverfew. Feverfew can be used to help with prevention. Not only that, but it also has been shown to help in terms of the severity of the headache once you get it. And we'll put the dosage for that as well. One of the side effects, however, is mouth ulcers and gastrointestinal irritation. So be aware of that. The other one is called butterbur. This specifically will help with decreasing the prevention, not so much helping with the severity of the headache once you get it. And as Dr. Sue mentioned, is that when we look at headaches, and even in conventional medicine, and we divide the treatment plans into prevention and then what they call the actual treatment once you get the headache, and the medical term for that is the abortive treatment. And now Dr. Sue is going to talk a little bit about mind-body techniques.
Mind-body techniques are really useful in prevention of migraine headaches because there's a correlation between emotional stress and the development of migraine headaches. Under the blanket of mind-body therapy, we have cognitive behavioral therapy, biofeedback, progressive muscle relaxation, I have a list so I don't forget, hypnosis, and mindfulness-based stress reduction. Did I forget anything? So try to pick something that you would feel comfortable with and it will help you. In cognitive behavioral therapy, you're learning how to stop the really negative thought patterns like the feelings of worthlessness, helplessness, emotional trauma, self-blame, catastrophizing things. And in that way, you're decreasing your stress yourself. It's also helping to identify anxiety and anger, which can precipitate a migraine headache.
Hypnosis is another technique under the umbrella of mind-body techniques. Now, hypnosis has been shown actually to decrease the frequency as well as the severity of migraine headaches in both migraines and tension-type headaches.
Meditation is a practice, which means that you should do it regularly. If you do it regularly, it does help prevent migraine headaches. How it does is that there's actually studies that show that it improves cardiac function, heart function, mood, well-being, blood pressure. These are all wonderful effects that meditation can have. There's a form of meditation, I wrote it down so I don't forget. It's Kabat-Zinn's 8-week mindfulness-based stress reduction program. And this is an 8-week program. It's effective for reducing headache severity in migraine sufferers and also tension type headaches as well.
So let's say you actually experienced the acute migraine episode, and some of these other techniques that you've had have actually been able to decrease the frequency that you get it. But once you get it, now what can you do? Now, there are a lot of prescription strength medications that are out and available now, and I'm not going to go into those, but there are some things that are that we do that are a little bit different, that under the umbrella of integrative medicine. And one of them is that we use IV therapies, and one of the most common one and recognized one right now is IV magnesium therapy. But you got to get it right. The IV and the infusion of the magnesium while you're getting the bad episode of the headache, and actually decreases the duration and severity of that migraine. Some of the other things that are being used now are something called sphenopalatine ganglion block, and it sounds like it's a big medical term, but basically all we do is slowly drip lidocaine through each nostril, especially if you have headaches on both sides, and it has to be done in an outpatient setting. You really shouldn't be doing any of this at home. Some other techniques, of course, include chiropractic and manipulation and massage, but then these are indicated if you have significant neck pain at the same time. So if it's just the headache part and you don't have the neck pain as well, I'm not sure the evidence is very clear about how it works. I'm sure somebody out there that does this a lot might disagree with me, but that's all I could find in the studies right now. The other one is acupuncture. Now, acupuncture is very popular, especially for chronic pain syndromes. When it's used for acute episodes of migraines, it's not, the evidence doesn't show that it's that effective unless it's used in conjunction with some other techniques like the medications or some of the other things that I mentioned. So that acupuncture by itself does not, studies do not show it works very well for the acute or abortive episodes of migraine headaches. The last thing I want to talk about really is use of marijuana with migraines. If, again, we mentioned this in our last video, some of the evidence coming out now is that people that have these refractory killer headaches that can't get rid of them, marijuana seems to have a role. As the evidence starts coming up, we're going to be following it. We'll bring it up and review it in the future.
We really hope this was helpful so you can have a better quality of life because of this integrative approach to treatment for migraine headaches. Our midweek check-in this coming week is going to be about vitamin D. Vitamin D is a very important vitamin, and we'll talk about how much to take, what your normal level should be to be healthy and well, and what kind of tests to get.
Next week's topic will be on menopause. Well, that's all for today. We really thank you for joining us.
And we'll see you again in our next video.
Bye-bye.
Con culo de mula y no le tengas duda, ella le saca todo el jugo a la uva. Que hace vino, sí, hace vino. De todo, de todo, de todo.
I'd like to keep our personal life personal.
Make sure you look at them.
En camino al club, yo la conocí en un taxi.